It looks like another line, but this one's talking to you all the time. I love an arterial line. My name is Leah. I've been a CVICU nurse for 18 years. Let's chat about A-lines. An arterial line, we commonly call it an A-line, is usually placed in the radial artery or the femoral artery. So this thin catheter, it's going to give us a beat-by-beat constant blood pressure reading. The thing that we like about arterial lines is because it's giving us second-by-second readings, it's showing us how a patient's responding in real time. We can give a fluid bolus and see as we're giving it what happens. We can titrate pressures and see within minutes what's going on. We love to have an A-line. Now they do have complications. Sometimes they have bleeding around the site. A patient can pull them out, especially our confused patients, our confused elderly patients especially can pull them out. We have to have constant monitoring in an ICU setting if a patient has an A-line or a setting like PACU where they can be really closely monitored, because if they pull it out, this is an artery and it's not just going to probably stop bleeding on its own. So you're going to have to hold pressure and make sure that it stops bleeding. You can also have issues where they just stop working because maybe they're a little bit bent. So we have arm boards that we put on our patients so that they don't bend as much. The longer they're in place, the less likely they seem to work. But they have this cool little setup that you can see that helps us to monitor, to transduce the pressure. If you have an arterial line and you have a non-invasive cuff and you're zeroing it like you should, then the arterial line should be more accurate, but only if it's positioned at the correct place, which is the phlebostatic axis, which is kind of like the armpit area, and you can see in this picture exactly where it is. So we love a good A-line. It helps us see what's going on with our patient so much better, helps us respond to things in real time. The most important thing I can tell you is never turn off your alarms on an A-line, even if it's not working. Just change the parameters, because you could have a patient that pulls it out or something really changes with your patient, and if you turn off those alarms when you still have an arterial line in, you're putting your patient and yourself at risk. So continue to follow this series. We're talking through hemodynamics.